Good afternoon, and the viewers at home.
Now, as I mentioned, the Free State province has now joined Gauteng, Western Cape, the Northwest and the Northern Cape provinces as those that have been confirmed to enter a third wave of the pandemic. Give us an update, first of all, on the new caseload in your province.
Okay, let me just go to the statistics of our daily stats. The Free State is indeed seeing the numbers that are steadily going up. Today, in the last 24 hours, we had 468 new cases. Out of those 468, 225 of them are from Mangaung, as Mangaung remains our epicenter as the Free State. And 79 is in Dabi, and 91 Chabong Chitanyana, 50 in Rizolipuzwa, and 23 in Harib.
Now, MEC,
so we've been seeing these numbers that are between 400, 500, and 600, and sometimes on daily basis.
And when it comes to the hospital loads, are you seeing also more hospital admissions?
Yeah, more. We are indeed. The most hospitals that are under pressure is our private hospitals are under pressure. With the public, when it comes to public facilities, we still have more beds because we did prepare for the upsurge in all our hospitals.
So you'd say that the Free State province is actually ready for this upsurge that's been brought about by the third wave?
Yes, we are ready. We do have extra beds that if indeed numbers go higher than they are now, we are able to admit. We still have space for admissions.
In addition to the beds, do you have enough staff as well as oxygen supply, which does become critical?
Yes, we do have enough oxygen supply, enough staff, and we are continuing to employ more. We just have nurses that have just qualified right now. 143 of them will be getting their appointment letters this week.
And when it comes to one of the concerns that you've mentioned you have as a department, that's the slow vaccine rollout among the elderly, what are the causes of that slow rollout?
When we look at that as a province, one possibility could have been the issue of the cold weather. That in the past week we had a very harsh cold winter in the Free State. But we are dealing with that in the sense that we don't want to just think that it was the issue of the weather. We are going around with the trucks, the GCIS truck. We are trying to talk to the communities and loud hailing, encouraging them to come forward, because we are seeing numbers that have dropped. Like the universities can, within a day, vaccinate 2,000 people. But we've seen the numbers going down to below 1,000 at 500 a day or 400, which is to us is not satisfactory. We are expecting them to vaccinate at least 2,000, maximum 3,000 a day. And it's not just universities, but in all our vaccination sites, we've seen the numbers really going down.
So what would you say is the total number of people that then have been vaccinated so far?
So far, we have vaccinated in the second, the elderly. When we started with the elderly, we have vaccinated 60,910. These are the new vaccinations that happened when we started with the 6 years and older. They do not include the healthcare workers. Inclusion of healthcare workers, we have a total of 93,440. In fact, the target for us for the 6 years and older is 288,000. So when we have just vaccinated up to now 60,910, I don't think we are moving at the speed that we would want.
I actually wanted to know what your department's plan would then be to reach that target of 288,000 over 60s being vaccinated by the end of July.
That's what we want. But if people are coming at the rate that they are coming, we will not be able to reach our target. And we don't want to fail, because one more thing that makes the province's numbers go high is we have seen the school clusters. So we want to start vaccinating the educators as soon as possible, so that because what we have learned is that at the time when we vaccinated the healthcare workers, the infections among the healthcare workers has gone down, and lesser healthcare workers get admitted. So we want to vaccinate the teachers because we believe that can also bring down the infections that happen in the schools, because our numbers are going up because of the clusters that we find in schools.
Now, you mentioned that cold weather and bouts of cold fronts could be one of the things that are actually discouraging the elderly to come out for vaccinations. Another thing is the protests, the service delivery protests that also take place from time to time. Do you think that vaccine hesitancy might be another issue that's discouraging the elderly from coming out to get vaccinated?
Yeah, vaccine hesitancy, the uprisings that are happening from time to time within our townships, that also discourages people. And at some point, we do stop vaccinating people because of those protests, because the elderly can't move because the roads get blocked. So that also is one of the issues that really delays our vaccination program.